response of the rally to various places, including the palace of His Royal Highness, the Emir of Gusau. And at this point, we are here also to have a press conference. After this event, which is a press conference, in the coming days, there will also be other activities packaged to raise awareness on the disease and its prevalence in our communities. There will be tests, public lecture, and football match, among others. So I'm here in my capacity as Permanent Secretary, Cabinet Affairs, to represent my boss, the Secretary to the State Government, Malam Abubakar Muhammad Nakwada, who is unavoidably absent. So the speech, the remarks I'm going to make here are actually his remarks. Malam Abubakar Nakwada begins by, I stand here to join the rest of the world to observe the 2023 World AIDS. We are aware the United Nations General Assembly has declared 1st December of every year as the World HIV/AIDS Day. The day stands to commemorate people infected with the virus, create awareness on prevention strategies, and support home-based care for orphans and vulnerable children. This year's World AIDS Day is tagged Global Solidarity, Shared Responsibility, Communities Leadership to End AIDS by 2030. Distinguished personalities, we may recall that HIV and AIDS had been part of the deadliest diseases about 3 to 4 decades ago. It claimed millions of lives globally. The world therefore came together to find a way of reducing or tackling the spread of the disease. Therefore, the idea of World AIDS Day came into being. The day is marked World on the prevention, control, and management measures. ZAMFARA State, like other states of the Federation, therefore, must join this trend, and we have joined it. We have marked this day every year since the creation of ZAMFARA State in 1996. We are thankful to Almighty Allah that ZAMFARA State has recorded a tremendous achievement in the fight against the spread of HIV and AIDS in the state. As I am standing here, or as I am sitting here presenting these remarks, ZAMFARA has prevalence rate of 0.4%. With an estimated population of 5 million, 20,000 people are therefore affected by this disease. ZAMFARA leadership of His Excellency Dr. Lawal, through the Office of the Secretary to the State Government, is making all efforts to align with the global achievement of epidemic control of HIV/AIDS by the year 2030 through the best policies, through implementation of policies and programs, and in collaboration with other partner groups that will help towards achieving this objective. The government will ensure continuous supply of HIV test kits and provision of counterpart funding. We will also ensure continuous payment of salary to the service providers involved in providing care and treatment support to people living with HIV within the state. The state government has also continued to provide support to people living with HIV. There are 11,172 patients that are currently accessing drugs in the state facilities and one-stop shop. The State Agency for the Control of AIDS is working closely with relevant stakeholders and development partners to ensure effective and efficient provision of HIV control services in the state. The state also provides an enabling environment for the partners providing HIV services in the state. We therefore extend our appreciation to the partners, most especially the Health System Councils Limited for the general population, the Society for Family Health for the key population, Pro Health International for care and home-based of OVC, and the United Nations Population Funds, UNPF, for their tireless efforts to support HIV control activities in the state. Before I end these remarks, I would like to extend our appreciation to the State Ministry of Health for its cooperation in the fight against the spread of HIV and AIDS in the state. Thank you all. Wassalamu alaikum.
In the last survey that we did, that's 2018. That's when we have the 0.4. And during that process, now a certain group of people were identified as the group of people with high prevalence of the virus. So now focus being projected towards them. Now there may be part of the reason why you see cases are being identified more, or new cases, more cases are being identified, because there is increase in focus on those personnel. Yes. Yeah, I'd heard you.
20,000. So the fact that we had 11,000, less than 11,000,
Last year
means that we need to go further and identify each and every one of these 20,000 estimated individuals.
Yes.
So next year you might see more than this, because more effort is being put in place to identify each and every individual that is carrying HIV in this state. Because one person unidentified is one person too many. One person is enough to spread disease and bring it back again to the society. So maybe next year we expect to see more.
For marriage, I don't know, maybe in that case I don't know whether there is any plan actually, because I think it is, if at all the state government is going to enforce this kind of measure, so it requires a resolution by the Executive Council, and it may even require, you know, maybe a law to be passed by the State Assembly before it is. So in my position, I can't actually say whether the state government have anything, you know, in the office.
Somebody has something. I am Badarabu Muhammad, and also Secretary Network of People Living with HIV. As you all know, Network of People Living with HIV is a group of people living with HIV that come together to find a way of solution to HIV. As we are living with HIV, we don't want to see people being infected with HIV every day. And we discover that a lot of people are getting it through marriage. So we try our possible best since previous administration to see how government can come in and make a law like other states have been done, and it is contributing in reducing the prevalence. We couldn't achieve that. So even today, in our meeting with His Royal Highness, we gave him a paper as a stakeholder and a father, because we follow through politicians. Like this is a paper that State House of Assembly 2021, the previous administration, even call us for public hearing, and they dismantle us and ask us to go. They will call later, and up to date they couldn't come. That is why this year, because we know the priority of testing before marriage can lead to stop the spread of HIV. And in our context, it's not only HIV we focus. There is hepatitis B and C, and there is genotype, which is bringing the children with sickle cells, and they are suffering. We all included it and begged for the government to do a law that will mandate such tests so that people can be safe through the law in this state. Thank you. And we are hoping and having a confidence in His Excellency the Dalawal Berry. All the previous government refused to help us, and now we have a confidence in the Dalawal Berry that this work will be completed, inshallah, within the state.
Thank you. The test before marriage is really essential in preventing, you know, a further spread of this disease. I think I'll take up this issue. Definitely, I'll take up the issue with the SSG when it returns. So we're going to make a case for a law to be enacted to make it compulsory.